Thank you for joining us for our first series in chronic pain. Patients are abandoned by their doctors, which is not a safe medical treatment. We are determined to shine a light on chronic pain, mistreatment of patients, while sharing how medical marijuana is providing us the ability to reduce pain. We begin this segment off reminding you, you are important and your pain matters. Hello and welcome. We would like to invite you to join us on a journey today with patients who are studying, learning, and trying to share how we use cannabis to treat our medical conditions and most definitely treat our chronic pain. We have a serious problem in today's with chronic pain patients struggling to have access to quality treatments, and doctors are pushing a lot of us out of the door. And so we wanted to come together and share what it's like to be a medical cannabis patient and how we're using it to help us treat our health conditions and improve our lives. Today, I'm joined by Leah and Red4Med. So I would like to start by introducing that my name is Debbie. I'm 62. I use medical cannabis to treat chronic regional pain syndrome, fibromyalgia, arthritis, tendinitis, as well as COPD, MAC lung disease, thalassemia minor. When I started cannabis, I never thought that I would be using it to treat all of those health conditions. It has truly been life-changing. Thank you. Red4Med?
My name is Red4Med, and I am 25 years old, and I use cannabis to mainly treat lumbarization in my back, which gives me extreme lower back pain 24 hours a day, 7 days a week. But I also use it to treat migraines and cramps, just a variety of things that happen.
My name is Leah, and I'm 62, and I am a nurse, and I only work very part-time. I am disabled, and I use cannabis for neuro and spinal and orthopedic. I've had over 14 orthopedic surgeries, and in the last 2 years, I've had major C2 through C7 and lumbar rods. So I really need it for pain.
Yeah, it's
lovely.
It is lovely. It has definitely made a difference in all of our lives, but I'd like for us to try to share with people what it is that helped us decide to start trying to use medical cannabis, because it's something that's very new to most of us. I've only been doing it for 4 years, so but the decision to go here is not easy. So Leo, how did you decide to start using cannabis? And
I was getting ready to have the 2 big procedures, and I knew that the way doctors were going to treat us post-op was going to be very different than my previous experiences. And so I talked to my doctors, and I was told that if I used cannabis or CBD, that I would be fired as a patient and lose my continuity of care, and also that I would go through, which I did for a period of time, where even just for 150 milligram tramadol a day, I had to be drug tested every month. And I was very disturbed by that. So I went to my naturopath. He was very supportive, and I had both of those surgeries with great success using really highly doses of CBD, but I did use cannabis all throughout as well. And it was all a very, very different experience. So I'm happy.
have you ever had surgeries before you had used cannabis and had the same results, or do you think that cannabis made the process a simpler process?
It was a much simpler process, yes.
That's good. Red4Med, what made you decide to try cannabis?
Well, I tried everything that I could do to try to attempt to relieve my pain, from different exercises to different types of pharmaceuticals, and nothing alleviated my pain, which led me to try cannabis. And originally I had started cannabis recreationally, not knowing the benefits that it could do to my body. So then I quickly turned medical, and it just helps me alleviate my pain and helps me concentrate with my life.
For me, pain management has been very critical and crucial for the last 25 years, basically.
Yeah.
I have started out with pain with arthritis, but in 1995, I developed what's called CRUPS. And for 15 years, I was receiving OxyContin to control that pain. And then all of a sudden, my doctor just kind of threw me to the curb and said that he wasn't going to treat pain any longer. And so I was stuck looking for something to replace what he wasn't going to provide anymore. It was a very scary and frightening period for me and my family because I have other serious health conditions that I live with and that I was struggling with at that time. And so it was really hard period, and there were no options except for cannabis that were available to me. So I was forced to start tapering off OxyContin immediately, and it was very hard, and we'll get into that as we continue these podcasts. So it's something that I wish I would have had access to cannabis back in 1995 when I started with all this pain that I have that's so severe, because I believe my health would not be in the shape that it's in today. I believe all of that struggle for years with the pain has created more health conditions and made me live the life that I live now. A life that I'm happy to have now because of cannabis. It has given me a new look on life that I didn't have before. How did you tell your family and your doctors or whoever that you were going to start using cannabis, Red4Med?
To me, it was extremely nerve-wracking to let anyone know that I used cannabis because I was afraid of what they would say about me. I did not want to be labeled as a drug addict, and in some people's mind, I was. But that's why I'm here as a part of Effective Cannabis. I want to be a part of educating those people that do not yet comprehend how powerful this natural medicine is and how it can actually change one's life.
Absolutely agree with you on that. It's something that is very powerful, and the thing I say generally is that if you don't have something to treat, you can't experience what all of us experience with cannabis. Not that we wish for anyone to live in chronic pain or have any illnesses to treat, but if you do, learning that you can feel better, you can be uplifted, that you can laugh, you can relax, is something that's so foreign and different from dealing with pharmaceuticals, because I've never taken a pharmaceutical in my life that makes me feel uplifted or wanting to really go out and be gung-ho about changing the world or making a difference. I mean, I always want to help people, but I mean, this has been so life-changing that it has brought me here to where I would like to share this with other people. How about you, Leah?
It was really my kids that took me to here. I grew up, I've been in a medical family, law-abiding people, and I was always afraid of going to prison. I mean, we were teenagers during that era, and, you know, I knew a lot of people that went to jail. So I was very, very anti-cannabis, and I only smoked very briefly when I was a very young teen, and I just walked away from it. So going to it was very hard. But it was really my kids. They live in Washington State, and they were telling me what they were seeing. And when my naturopath and my physician, my physical therapist, one of my pain treatment people were talking to me about it, I'm like, why not? It's legal here. So I can be supervised, find support for it, and I did. And I'm very happy that I did, because it changed my life.
That's very good. For me, it wasn't a matter of how I told my family. My family was very involved in my traumatic experience of being kicked to the curb and not having access to medication. So it wasn't a choice of, am I going to tell my family? It's like my family was pushing me just as hard as I was to get something because we knew our lives were about to change. I've lived where I didn't want to be here anymore because my pain was so intense. And I don't want anyone to feel that ever again. I think it's really important that they understand cannabis can give you the ability to have a little bit of relief if you learn how to do it. And it's not an easy process, but that's why we're here trying to share so that maybe they can learn. And what works for you may not work for me,
Right.
because we have different pains and stuff. So it's definitely something my family has been supportive of, and it's something that some of my family have been very against cannabis and have strong feelings about it. And now I can actually say, because they've seen how my life and my health has improved, that cannabis is really not so bad. So I think we're making some really good accomplishments with each person that we can change, and they can see what a difference it makes. And that's part of why we're here, because we always hear how cannabis is helping patients, but we never see those patients. We never hear from those patients. We don't know what they're going through. We see people in the dispensaries, and it's one of the happiest places in the world, if you ask me, because everybody's always happy to be there, and they're just nice. But you don't stop and talk about what is your life, how are you doing it, how is it helping. Those are just not conversations you have in a dispensary. So putting a name and a face to people that are actually using cannabis to treat and change their health is really important, so that we can actually study this as medicine, because this is medicine.
Yes.
And we need to know how it's working. How is treating your pain in cannabis so different from pharmaceuticals, Leah, that you've tried in the past?
For me, I have been using traditional medications for about 28 years now, and I've had 4 bleeding ulcers. I have destroyed my bones. I went 9 years without sleep, and being in pain 24/7, and I need to function. I have children, I have a family, I need to do things at home. I need to be happy somewhere. And it's not just about joy and happiness, it's more about function. For me, it's function. I need to function in a good way. And I never had that before, never. So I've had my issues all my life. And we're going to talk a little bit later about specifically how it's changed, but I used to be on 30 medications. And that's not the ones for breathing, for asthma and all that. I'm just talking about every day I got to get up and move kind of things. And so the difference in pharmaceuticals is I'm not having to fight to get my refills. I'm not having all the side effects, the fog. I wasn't able to work for years in the 90s because I was so drugged up, and I hated it. And I took myself off suddenly, kind of like what you went through. It was by choice, but I just got frustrated at the amount of medications and how I felt. It was horrible. And I did it all cold turkey by myself and my 16-year-old son. And it was not pretty. It was not pretty at all. I should have gone to the hospital, but I didn't. I was done with it. I was ready to end my life living like that.
Yeah, and it's sad that we get pushed to that place. But yes, pain is one of the most destructive things. I've lived with lots of health conditions that are serious, and that some of them have almost taken my life as well. But nothing is more destructive than pain, because I don't know how to describe it better than just think of the worst pain you've ever had in your life and just think it never ends. Never. Yeah, it's there all the time. We're all 3 of us are still living in pain. It's just not the same pain that we lived in before we started cannabis.
Right.
And pain doesn't have a face necessarily. It doesn't have an age. If we're in pain, we're in pain. A lot of people are always telling me, oh, you're 25 years old. How can you be in so much pain? Excuse me, I didn't know I needed to be a certain age to feel a certain way. That's just my life. This is how I feel. I'm in pain.
And I don't think you need to look a certain way to be in pain either.
No, and I'm going to point my finger at the doctors. I'm going to tell this. I am not just a middle-aged, overworked nurse, overweight and depressed. That is not what put me in the situation where I was at.
Right.
That is what my doctor told me. And now I have a 20-year-old daughter struggling with something, and she heard it for the first time a couple weeks ago, and it just struck her so strongly when she heard those words.
Well, there's nothing more debilitating than to have a doctor come back and tell you that it's all in your mind, it's in your head, it can't hurt that bad, just get a life, go do something else, focus on something else. I mean, I don't know, you can, no matter what you can think of, I'm sure we've all three heard it,
Yes.
as well as millions of other people. And unfortunately, people still that are being told that today. And there's a serious issue that we need to address with chronic pain. We need to first understand chronic pain and the patient. This is about people. We're human. We need to stop treating our dogs or our pets better than we treat us. That's exactly how I feel. And I mean, I know that, you know, I love my animals, don't get me wrong, and I would never let my animals struggle and suffer through anything that I have had to struggle through with pain.
Exactly.
So for me, treating my pain with cannabis is so different because I started it, of course, because I was forced off of my opiates, and I started doing reductions, and I really didn't even know that it was going to help me handle the withdrawals that I was going to have from reducing at such high risk rates, which is something that should never happen. I don't recommend that for anyone, and anyone should be seeking help from somewhere to make sure they don't have to do that. But unfortunately, finding someone to help you is really hard. But I have learned that cannabis actually is helping other health conditions that no one ever would have thought of. So for me, I've been able to throw away most of my medications that I used to take. It saved me a lot of financial burden because, yes, cannabis is expensive, but when I think of all the pharmaceuticals that I've removed from my life and that I'm not looking at the clock, when is it time to take the next one? I'm just waiting for that next moment. I think that most of us are all very responsible with taking our medication when we're ill and we're in pain, because that's our livelihood. That's what keeps us alive. And that's one of the things that I've enjoyed the most about cannabis, is that I'm actually able to medicate when I need to. I can catch it before my pain gets so intense that I don't ever get to that place. And now, instead of living in a pain of 10, I can actually keep my pain to a level of 3. And if you would have ever told me that could happen in my life after developing CRUPS, I would have said that's not possible. But it is. And it's something that I hope everybody can understand, that this is an investment in you. It's an investment in yourself. And it's learning how to use cannabis that best fits your needs. And we all live with multiple medical conditions. It's not like we just have one thing to treat. I wish we did. It would make this journey a lot easier. But we're all treating multiple things, and finding what works for all of that is not so easy. So learning and using cannabis has just been such a different experience. And you're on your own, basically, to figure out, depending on where you go, who you talk to, determining on how to get started. It's really hard. And that's one of the things we hope that we can bring to the table, is to try to give you some direction on where to start or where to look. If you have these specific medical conditions, these are strains that would be good maybe to look into or something. This is not medical advice. This is what I call medical awareness. Making people aware of what they can do for themselves instead of depending on our doctors and our pharmaceuticals. It is really important that we maybe step into it ourselves. And Nugget, our little mascot, has decided to join the conversation, so you will have to excuse him.
We are real people living real life.
Absolutely, and we want to keep it that way. It's important that we are seen as who we are. And that's what we're trying to do, something a little different here than what's being done in general. How has your pain in life changed or improved with MMJ, Leah?
Boy, I bet if you ask my husband, you know, that happy wife, happy life thing is really true. So apply it to anybody you want. But basically for me, I mean, I'm very aware. I'm probably overly conscious about my use. And I would say it gives me periods of the day where I can not only just basically function, which is what I was looking for in the beginning, to now I actually enjoy life. And I enjoy being with my husband, which we've been married, it'll be 36 years this year. And there are a lot of times where you cannot touch me. You can't give me a kiss. You can't touch me, on the back of my neck. You can't put your arm around me. I'm in so much pain. And that in itself is huge because I was taking so many muscle relaxants and antispastics and neuromeds. And now I'm actually a part of life and I'm actually enjoying it to be there. I'm not high. I am just basically very content and very happy to wake up now. Waking up and going to sleep at night was the hardest parts of my life because waking up, not knowing how the day is going to go and how much pain I was in the minute I opened my eyes was horrible. And I don't have that anymore.
That's awesome. I wish everyone could receive that and feel that. That's my absolute wish for everyone.
And it's not a shot and it's not a pill. It is just a way of living. You find out what your routine's going to be. And now I can do all the other alternative things that work. It's all working together and I like it.
Yes, me too.
My life has improved drastically since I started my journey with cannabis. I can actually concentrate more on my daily life rather than being consumed by my excruciating back pain. I'm a college student and I also feel like cannabis has opened a new mindset for me and has created a path to pursue my dreams pain-free because I get to concentrate when I'm in school and I give myself fully instead of just being consumed in my brain by my pain. So it has drastically changed and improved my life.
Do you find other college students are even discussing this topic, or is this something that's still kept very quiet, hush hush?
Well, I've met people in my classroom that usually are not medical users but are recreational, and we start talking about the benefits that it gives them and that it gives me. And there's only a few people that I've met, but there is a little bit of openness as far as other people my age that do talk about it and that are doing it. But yeah, there is a few discussions, but not a lot of people are doing it medically because they're afraid or they don't think that what they feel is a medical illness or anything that they can treat medically. So they're just living life with different strains, not knowing what specific strain to go to when they're feeling certain things. And they're just going to dispensaries, just buying things, or even black market, not knowing what they're consuming. So there is a little bit of discussion, but not that much of not everyone is open to it. So
well, and we're finding that in general, whether it's at work, whether it's at your doctor's offices, whether it's at the grocery store, the pharmacy, we still have a large population that's just really nervous about cannabis and what it can do, and we're hoping that we can educate so that people can see we're just normal people looking to improve our health. We're not looking for anything else. I'm not out to have a party. I want to feel good though. I want to laugh. That's one thing I can
enjoy
say.
Dinner.
Yes, exactly. For me, that's one of the biggest things that has changed is I think that I've realized I was always looking down once I became so sick and so struck down with chronic pain. I couldn't even look up. And now that I'm using cannabis, I actually am looking up and I'm actually wanting to advance myself, my health, and want to make sure other people have and can see the same information. I don't know what pain management's best for anyone. I believe we need all options on the table.
Yeah.
But cannabis for me is far better than OxyContin was at high doses. I'm still on OxyContin. I'm still at 30 milligrams a day, but I was at 240. And it's been a long journey to get here because I've had serious health complications along the way. So it's not been an easy road, but it's a road I would take every time again. If I had, when I started this journey, I did not know that it was going to be like this. But if I had, even if I had to go back through all of those bad times and all the hardships that this caused on me and my family and almost costing my life, I would choose it again to have this life that I have now. It's about the quality of life that we live. It's not the quantity or how long we're here. If I'm only here for one more day, I want it to be the absolute best it can be. And I only wish that for everyone else. And cannabis has really made that possible. I've eliminated over 20 medications by using cannabis, and all of those medications had side effects. The side effects that I experienced from using cannabis are things like not being accepted in the medical community, not knowing whether I could apply for a job and get it if I was healthy enough. It's not the usual side effects that people have from pharmaceuticals. We have other challenges that we have to struggle through, but it has definitely been life-changing. How has your doctors responded to you? I know, Leah, you talked about this a little bit earlier about your doctors, not wanting anything to do with you. So Red4Med, how has your doctors responded to you and you using cannabis?
My doctors did not, well, my previous doctor wanted nothing to do with me if I continued to medicate with cannabis. He even stated that within 1 year from when we spoke, I would not be able to carry on the same conversation that we were having. And he was obviously wrong, because here I am advocating for medicine that has changed my life. I have a new doctor now, but I'm honestly pretty nervous to bring it up with them because of my past experience. So it's kind of a secret for now. So with my new doctor, definitely. I'm just nervous because I don't want to have issues or him thinking, oh, you're just a drug addict, get out of my office, because that's usually what kind of happens.
And I find that it happens no matter what age we are, but I find that when you're younger, we see that even more so, because since you are, like you said, 25, they just think that you're just wanting to party. And that's not true.
And they don't believe my pain number when I tell them, from 1 through 10. They have asked me, what pain, what level of pain are you in today? And I literally have said, there's days that I've just been at a 10, and I told them, and they started literally laughing. And he said, how can you be at a pain of 10 if that is childbirth? That's excruciating pain, like if you were having a child. And I was sitting there on the table looking at him, like thinking, how in the world can you tell me that my pain is not a 10 when you're not inside of me and you do not feel what I am feeling? If I am telling you that my pain is at a 10, it's because it's at a 10. And sometimes, they're just thinking, oh, she's young, how can she be in so much pain? Oh, she's over here just trying to party and, get drugged up and all these things. But that's not ever, it has never been my intention. And, cannabis has helped me relieve those symptoms and have kept me still pushing forward and, advocating for cannabis, because this is medicine. You don't need to drown in your pain. You don't need to get to a point where you don't want to live, when there's something out there that can help you get to a good state of mind, and you are in control. You are in control, and not your doctor or anybody else. You can make that decision and start it for yourself and actually, feel the difference, not just hear about it, actually experience what we're feeling, the effects it's having on us. And so, I'm really nervous to tell my doctor, but again, cannabis is working for me, so I'd rather just kind of keep it a secret for now and see what happens.
For me, doctors have been kind of all over the place. I have some doctors that, well, when I started this, I was begging my personal doctors to help me when my doctor decided he didn't want to do this anymore. And of course, everybody just said, we can't help you. Just something we can't do. So I was left on my own begging other doctors that I've never even met. And that's even scarier because those doctors don't know you and they think you're pill shopping. And that is the last thing I was doing. I was trying to treat a serious medical condition that I have. It's a registered medical condition within the medical community, and it has known treatments. But we're just deciding to stop treating these medical conditions now as out of fear. Doctors are afraid, and I get it, but I don't get it from the standpoint of being a patient. And you don't just treat someone for 20 plus years and then just decide, oh, well, we're not going to treat that anymore. That's just not an acceptable treatment, and that's just not the acceptable way to treat a patient. I also come from the medical field. I went to school to be a medical technologist and study the bloods and the fluids in our system to understand how we work. And so I've always kind of been a little nerdy about medicine and understanding how it works. And I have spent every minute since I started using cannabis learning about cannabis and how to improve my health with it. This isn't something I take lightly. It's something I take very seriously. And now I spend most of my time at my doctor's appointments talking to them about the benefits of cannabis. And they're curious, but they just don't know how to apply it or what to do. They're not taught this in medical school at all. So it's a very scary place for them to be, to try to teach us and work with us on, cannabis versus treating us with pharmaceuticals that they're now getting in trouble for providing, or they're afraid they'll lose their livelihood, their license, and they spent all this money to go to school to be a doctor. I understand it, and we would love to work with doctors to help them understand how cannabis is medicine. That's the power we have as patients right now. We're the ones that are off doing this ourselves, trying to figure out how to treat serious health conditions. And no one really is helping us. So, when your doctors are sitting there telling you that, well, yeah, you can do it, but I won't have anything to do with it, how are they supposed to continue to treat the rest of me? When we've eliminated all the medications and I'm using cannabis, I don't know how they contribute to helping me with my health sometimes. It's really frustrating. And I do have serious health conditions that I still need doctors for. It's not like I can walk away. So it is life-changing.
Ladies, that ends our discussion today. Thank you to your openness and commitment to helping others. Sharing our experiences hopefully will bring awareness to those who are still living in undertreated or untreated pain that we once endured. I thank you both for taking some time out of your day to share with others the importance cannabis and CBD have played on your pain in life. We thank all of you who tuned in. We do this for you. To stay informed on how patients are changing and improving their pain, health, and life, be sure to subscribe or follow. If you are on YouTube, select the notification bell and you will be notified when a new series is available. We are here to help you learn. Come join us as we work to improve pain, health, and life. Echo Podcast is provided by EffectiveCannabis.com, where patients help patients learn, share, and teach how to improve one's health and life using cannabis and hemp. They are here to help and assist those living in chronic illness and chronic pain. Effective Cannabis does not sell or produce any products. They passionately care about you. Drop in, see all they can offer you as a patient. They understand living in chronic pain and chronic illness. They all live it too. I leave with one final note. If you live in chronic pain, we understand you. We know what it is to hurt, to have a pain that will not stop, and to have no relief. You have every right to have your pain recognized as a medical condition with quality, safe treatment options. You are not alone. We thank